Adventures in Colorectal Cancer, 2026, July 25th. So yesterday, I had another call with the medical oncologist. So this is the second telephone call since I first was at his office. And when I was first at his office, I asked him, I was seeing a lot of doctors, and I asked him, what his role was in all of this. And he said, well, if you have a tumor, I'll treat the tumor. So I had a bunch of questions, like, number one, since I don't have a tumor, why was this the second telephone call? Like, I thought, my impression was his job was if I had a tumor. He said, oh, no, I'm just checking up on you to see if you, how your treatment was going and to make sure that I was up to date with everything. Okay. I asked him, when does the 5-year morbidity rate start? Is it at diagnosis or is it at end of primary treatment? And he said, well, it really doesn't matter because they're usually really, really close. I'm thinking, well, 8th of April was the colonoscopy that found the tumor, the cancerous polyp. So, like, that was 4 months ago. So, like, okay. I asked him if there was, so all treatments that are paid by BC Medical are on the schedule of approved treatments. Doctors tend to stick pretty close to those because patients, it's free, right? It's free. And I asked him if there was something in the approved, not on the schedule of approved procedures, that would clarify whether or not they got all of the tumor out. Because, like, my whole treatment schedule is hinging on whether or not they actually got it all. And he said, well, I have to ask the colorectal surgeon about that. So he's not going to weigh in on that. I asked him, when I was in talking to the colorectal surgeon, I went from, you have to have surgery, to, well, I don't feel comfortable monitoring you because I figured it's a dereliction of duty of care. Do you want surgery? No. Who wants surgery? To, well, how about radiation? So yeah, so I'm going like, well, why weren't these options presented to me to begin with? Oh, you have to talk to the colorectal surgeon about that. Okay. And then he made some sort of comment about, I said, well, it's been, he said, when did you last talk to him? I said, well, it was the 22nd of June. He said, you haven't heard back from the Cancer Review Board or the radiation guy? I said, no, I haven't. He said, well, that's kind of long. I'll ping him and see what he says. But, it might be because you refused surgery. I said, whoa, I didn't refuse surgery. I was given I was asked if I would prefer radiation over surgery. I asked what the morbidity rate was between surgery and radiation, and told that surgery was slightly better. So I'm going like, well, who wouldn't want to take that chance, So no, I didn't refuse it. I was given a choice, and between surgery and radiation, like, who? I know where surgery's. I've got a really clear idea of what surgery entails and where it goes. So, and then he was quite helpful in saying, "Oh, well, I'll touch back with you in another 8 weeks to see how it's going," and recommended that I call the CR surgeon and figure out what's going on. But then again, this might all be moot because this morning, I think I had blood on the toilet paper again, so it might be bleeding from my rectum again. I've got a friction burn from doing sit-ups. I'm losing weight, intentionally losing weight, not, and so I wound up with a friction burn from doing sit-ups. So I'm not sure if it's from the friction burn, which tends to bleed a bit, or if I'm actually, there's something going on in my rectum again. Yeah, so making appropriate life decisions. You don't make any money, but you get good stories.